the idea of public health, if you go back to it historically, it was really about communicable disease control. That's what the CDC's original name was, the Centers for Communicable Disease. And that it was founded in response to malaria. And now it's the Centers for Disease Control. So there's a plural there. And they have other parts of the CDC that are working on injury prevention, for example, or environmental health, or occupational health. And all of that, those budgets, if you put those together, I mean, that's very substantial funds that are being spent on what weren't the core objectives of the CDC. And then you find that the CDC is constrained in its core mission, what they're designed for. And then I think that's how you end up the way we are, where you have a CDC that's under-resourced and underfunded because they've got so many extraneous things that they're dealing with. And it's been argued that they spend more on non-infectious disease stuff than they do on infectious disease. And no one would ever think of that because the CDC, they're the disease detectives. I mean, they're the preeminent agency. I mean, I sort of idolize them as and I still do for the people that work there. Some of the stuff that they've done. I mean, that's where the eradication of the smallpox virus from the planet came from. Was from from someone from the CDC. My former mentor, D.A. Henderson, who then went to the WHO and ran that program. So I do think that that's the case, and it's not just the case at the CDC. It's even the case at the local health departments, where the health departments are worried about nutrition or rating restaurants on their nutritional value, worry about what air pollution and air quality, lots of things that are important issues. But it's important to know that they're moving funds for those politically prioritized projects, and not staying on and being resource constrained in their core mission. Because no health department, if you think of like a local health department, they want to say we're the best at stopping all these gonorrhea cases. I mean, that's not something that's not flashy. But if they talk about air pollution, that's really flashy. That gets headlines. But so this is kind of the perpetual problem with the health department. When it's working well and they're doing their core job, you don't even see them or hear them because it's all working. It's all unseen. That you're not getting tuberculosis cases in your town. You're not having syphilis spread rampantly because all those cases are being identified and contact tracing is going on. But it's not something anybody wants to brag about. And our health departments go through these crises, these series of panic and neglect, where when there's an outbreak or something, or during anthrax, for example, they got tons of funding, and then it goes away and people forget about it, and then they go back to these non-core things. And that's why we are always constrained with our ability to respond to actual public health crises with contagious diseases, because that's not something that those agencies are prioritized by. Many health departments don't have infectious disease doctors even on staff, even at the state level, because there's so many other priorities that are much more politically prized than communicable disease control, which is why they were founded. I mean, think of Typhoid Mary, and that's what you think about when you think about public health.